Anemia is a condition in which the number of red blood cells or hemoglobin concentration is below normal for a particular age and sex. According to the World Health Organization, anemia is defined as a hemoglobin concentration of less than 13 grams per deciliter in adult men, less than 12 grams per deciliter in adult women, and less than 11 grams per deciliter in pregnant women. Anemia is the most common hematological disorder worldwide, affecting approximately 25 to 40% of the global population, with the greatest burden in sub-Sahara Africa and South Asia. High-risk groups include infants and young children under 5 years, pregnant women, and women of reproductive age. Hemoglobin within red blood cells is responsible for oxygen transport to tissues. A reduction in hemoglobin results in tissue hypoxia, triggering compensatory mechanisms such as increased cardiac output and enhanced erythropoietin production. Anemia may be classified based on etiology: decreased red blood cell production in nutritional deficiency of iron, folate, and vitamin B12, bone marrow failure due to aplastic anemia, exposure to toxic chemicals such as benzene, pesticides, heavy metals, radiation exposure, chemotherapy drugs such as alkylating and platinum-based agents, viral infections including HIV and hepatitis viruses, inherited bone marrow failure syndromes such as Fanconi anemia, bone marrow infiltration by malignancies, most especially leukemias and lymphomas, chronic kidney disease leading to reduced erythropoietin production. Increased red blood cell destruction, known as hemolytic anemia, may occur in autoimmune diseases including systemic lupus erythematosus, bacterial and viral infections, mechanical destruction due to prosthetic heart valves, drugs such as sulfonamides and anti-malarials, inherited disorders including sickle cell anemia and thalassemias. Hypersplenism. Blood loss may occur in chronic gastrointestinal bleeding due to peptic ulcer disease and gastrointestinal malignancies. Menorrhagia and postpartum hemorrhage. Acute blood loss due to trauma or surgery. The cause of anemia can also be inferred from the morphology of red blood cells, assessed using red blood cell indices, particularly mean cell volume. Normocytic normochromic anemia as seen in anemia of chronic disease, acute blood loss. Microcytic hypochromic anemia as found in iron deficiency anemia and thalassemias. Macrocytic anemia as seen in megaloblastic anemia due to vitamin B12 or folate deficiency, liver disease, alcoholism, and hypothyroidism. Clinical features of anemia may be general or nonspecific and specific due to the underlying condition or the type of anemia. General symptoms include fatigue and lassitude, weakness, headache, dizziness, dyspnea on exertion, palpitations. General clinical signs include pallor of skin and mucous membranes, tachycardia, cold extremities, flow murmurs. In severe cases, features of high-output congestive cardiac failure may occur. Investigations include complete blood count, red blood cell indices, peripheral blood film, reticulocyte count, iron studies such as serum ferritin, serum iron, and total iron binding capacity, vitamin B12 and folate levels, hemolysis markers including lactate dehydrogenase, bilirubin, and haptoglobin, bone marrow examination when indicated. Anemia is not a disease in itself, but a manifestation of an underlying disorder. Management depends on identifying and treating the cause and may include nutritional support with iron, vitamin B12, and folate, treatment of infections or chronic diseases, blood transfusion in severe or symptomatic cases, and disease-specific therapies such as immunosuppression and stem cell transplantation. In conclusion, anemia represents a common and significant global health problem. A systematic approach involving classification, clinical evaluation, and targeted investigations is essential for accurate diagnosis and effective treatment.